Do you know what to do if someone suffers a head injury? Understanding and acting quickly in such situations can make all the difference. Today we'll guide you through the steps of first aid for head injuries. Firstly, it's essential to remain calm. Panic can cloud judgment and delay necessary actions. If someone has a head injury, your composed demeanor can help soothe them and make them feel safe. Next, call for medical help. Dial your country's emergency number immediately. While waiting for help, avoid moving the injured person unless necessary for safety reasons. Unnecessary movement could potentially worsen the injury. Now, if the person is unconscious, check their breathing and pulse. If they're not breathing, start cardiopulmonary resuscitation, otherwise known as CPR. If you're unsure how to perform CPR, the emergency services operator can guide you. However, if the person is conscious, comfort them and try to keep them still. Encourage them to remain seated and discourage them from shaking their head or moving around. If there's bleeding, apply a clean bandage if available, or a clean piece of cloth will do. Don't apply pressure if you suspect the skull may be fractured. Monitor the injured person closely for any changes in their condition. Look for signs of shock such as rapid breathing, a fast pulse, dizziness, or pale, clammy skin. If these signs are present, try to keep the person warm and reassured until help arrives. In the case of a minor head injury, after stopping the bleeding, apply a cold pack to the area for 15 to 20 minutes every 2 to 3 hours. This can help reduce swelling and pain. To recap, in the event of a head injury, remember these key points. Stay calm. Your composure can help keep the situation under control. Call for immediate medical assistance. Time is of the essence in such instances. Avoid moving the injured person unless it's necessary for safety. If the person is unconscious and not breathing, start CPR. If they're conscious, keep them still and comforted. Apply a clean bandage to stop any bleeding, but don't apply pressure if a skull fracture is suspected. Monitor the person for signs of shock and keep them warm and reassured. For minor injuries, apply a cold pack to reduce swelling and pain. Remember, these steps are not a substitute for professional medical advice. Always seek immediate help in the event of a head injury. Your quick thinking and actions could potentially save a life.